The history of medicine in America is a tale of two realities. For some, it represents healing, progress, and trust. For Black Americans, it carries the weight of a dark legacy, one marked by exploitation, abuse, and profound betrayal. For centuries, Black bodies were treated not as patients deserving care, but as subjects of experimentation, their pain fueling medical advancements from which they rarely benefited. This grim chapter of American history is often brushed aside, minimized, or simply ignored. But the wounds of the past run deep, shaping the health outcomes and experiences of Black Americans today. The echoes of forced sterilizations, unethical drug trials, and surgical procedures performed without anesthesia still reverberate through generations. This legacy of medical abuse has left an indelible mark. It has fostered a deep and understandable mistrust of the medical establishment within the Black community. This mistrust, coupled with persistent systemic barriers, continues to fuel health disparities that demand our attention and action. The Tuskegee syphilis study stands as a chilling emblem of medical racism in America. For 40 years, from 1932 to 1972, the U.S. Public Health Service deliberately left hundreds of Black men in Macon County, Alabama, untreated for syphilis. These men, mostly poor and illiterate sharecroppers, were lured into the study with the false promise of free health care. Henrietta Lacks, a Black woman diagnosed with cervical cancer in 1951, is another stark example of medical exploitation. Without her knowledge or consent, cells from her tumor were taken and used to create the HeLa cell line. This cell line has become a cornerstone of medical research, leading to countless breakthroughs and billions of dollars in profit. Yet, Lacks and her family received no compensation or recognition for decades. These infamous cases, while horrific, are not isolated incidents. They are part of a larger pattern of disregard and disrespect for Black lives within the medical field. From the antebellum South, where enslaved Black women were subjected to brutal experimental surgeries by Dr. J. Marion Sims, hailed as the father of modern gynecology, to the present day, the exploitation continues. The exploitation of Black bodies for medical advancement is a stain on American history. It is a stark reminder of the ways in which racism has infiltrated even the most revered institutions, perverting the very notion of care and healing. To fully grasp the depth of medical mistrust among Black Americans, one must confront the insidious reality of systemic racism within healthcare. This deeply embedded bias permeates every level of the system, from access to care and quality of treatment to medical education and research. Black Americans are more likely to live in medically underserved communities, lacking access to quality hospitals and a sufficient number of healthcare providers. When they do receive care, they are often met with implicit bias, leading to misdiagnoses, inadequate treatment, and poorer health outcomes. Furthermore, the lack of diversity within the medical profession itself perpetuates these disparities. Black physicians remain underrepresented in medical schools and leadership positions, hindering the development of culturally competent care and the dismantling of harmful stereotypes. The consequences of this systemic racism are devastating and far-reaching. Black Americans experience higher rates of chronic diseases, such as heart disease, stroke, diabetes, and certain cancers, compared to their white counterparts. They also face stark disparities in infant and maternal mortality rates. The road to healing and rebuilding trust requires a collective effort, a commitment to acknowledging the sins of the past and dismantling the systems that perpetuate inequity. We must start by confronting the truth of medical apartheid in America, in our classrooms, in our hospitals, and in our communities. Honest and open dialogue about this dark history is crucial to understanding the roots of mistrust and fostering reconciliation. Investing in medical education that emphasizes cultural competency and addresses implicit bias is paramount. Diversifying the healthcare workforce at all levels, from physicians to researchers to policymakers, will ensure that the needs of all communities are met. Ultimately, achieving health equity requires a fundamental shift in how we value Black lives. We must dismantle the structures of systemic racism that permeate our society and create a healthcare system that truly serves all. This is medical apartheid. As always, peace and love.